Hi YouTube, this is Stacy. It has been a long while. I just thought I'd give a posting and an update kind of where I've been. Gastro bypass I had December of, well, it's been almost 2 years and like 4 months. I was originally 325 pounds. I am officially about 158 to 160 pounds, so overall like about 170, like 5 or 6 pounds I've lost altogether. With the gastro bypass, that's been great. Other than I started having a lot of back pain around November of last year, and just thought I woke up, with like a crook on my back, you know, kind of with the pillow, and kind of put it off. Finally went to a doctor at the beginning of the year and saw a DO as a doctor, and he immediately thought it was my muscles just tensed up, so put me on a bunch of muscle relaxers. I can't take any anti-inflammatories, and I knew I was inflamed, so come to find out, he had manipulated me in my neck, and it got worse and worse, and then I lost all feeling in my thumb. And then about a week later goes by, and I demanded to go in there to get an x-ray and an MRI because I knew something was really wrong when I could turn my whole entire arm purple, and I lost all feeling in my thumb, and it just wasn't going my way. So what I ended up having to do is he talked me into letting me be manipulated one more time because he was for sure that I had MS or MD, and I knew it wasn't that. I knew it was something that was definitely pinched off. I just didn't know what. So I had an MRI on February, I want to say February like 7th, and then I was in so much pain after he manipulated me. At the MRI, the tech had actually asked me if I was going to be talking to my doctor, so I sent him a message. He sent me a message back. Basically stated I needed to get in. By that Friday, I couldn't even move my neck or my arm. I was in so much pain. I was basically crying nonstop, and I went in right away to see the neurosurgeon, and come to find out I had a bulging disc that was protruded into my spinal cord. And basically saw him on Friday and had surgery on Monday, and had this lovely scar here, c-5, c-6 anterior discectomy fusion. So basically I have screws and some titanium plate holding my spine together to fuse back together. Since the surgery in February, I ended up in the hospital. So those of you having gastro bypass, my surgeon learned the real quick way is not to give me a bunch of meds, because I ended up spending about a week in the hospital for my surgery. They sent me home. I was constantly throwing up and nauseated from all the pain meds. I ended up getting extremely whacked out on all the meds. I ended up back in the hospital a week later. I stayed for another week because I was so dehydrated and so sick that after about a week they got me rehydrated, and about 2 days later I ended up with such severe stomach pains that I ended back up in the hospital for a third time to find out I had severe pancreatitis from all the medications. And at this point I'm still having a lot of almost more back pains with my left side versus my right side now, due to my muscles are overactive, and from the fusion surgery I'm still not healed, but I can't take any anti-inflammatories due to your surgery, so they're having a hard time with physical therapy and occupational therapy. I've lost 3, I had 4 digits originally on my right hand. I was feeling in all 4 fingers, and I gotten 1 back, but 3 of them are still dead as a doornail. I'm going through weekly appointments with occupational therapy, physical therapy. I have a spinal rehab involved. They're doing TPI injections. You name it, I'm doing it. I ended up being off work for roughly 11 weeks. I'm still going back part-time, but I have learned since surgery, I don't think I'll have any other surgeries since my gastro bypass, because you can't be treated. My stomach just doesn't take any kind of medications. Overall, you know, my health is pretty good, and ended up finding out that I had bone degenerative disease, and that's how the whole protruded disc thing ended up happening. But the downfall is I was thinking in the next year or two I was going to have some of my wonderful, I don't know if you can see that right here, my excess skin I was going to have removed, but with all the complications I had with my spinal surgery, I'm not having surgery. I'm going to deal with my wrinkles, I guess is the way that I look at it. Sometimes life's too short and it's not worth going through all that just to look beautiful. To me, I'm beautiful. I've lost 176 pounds. I weigh less than what I've lost. I'm in about a size 9. Perfectly happy with the size 9. I ended up losing about 15 pounds in the hospital, and I gained back about 5, but overall my healthiest I was at about 170, and now I'm about 155 to 160, and I'm okay with that. I'm in normal weight. You know, my biggest downfall right now is dealing with this spinal surgery and getting healed from that. So any questions, let me know. Take care. Thanks. Bye.